Go to a football game and it's likely you'll see the team doctor on the sidelines. Well, more theaters are hiring their own version of the team doctor to wait in the wings. Jeff Levine has our cover story.
It's said that medicine is as much an art as a science. Now science is helping the arts.
Anytime you get injured, you kind of go, God, am I ever going to come back or whatever. It's very precarious.
At age 20, John White feared that a dislocated right knee could end his budding career in ballet. Conventional medicine wasn't much help.
The emergency room and all that, the hospital and everything, they didn't really know what to do with me.
Like, as a dancer, he needs to be able to move at very high speed because a lot of what he does is very explosive.
At the National Arts Medicine Center near Washington, D.C., they specialize in the unique problems of the artist. Dr. Richard Norris practices this relatively new discipline.
Well, they love it because instead of telling them to stop, which is often what they get in other places, we're able to work around their injuries.
In many ways, Norris says, this is occupational medicine with a special touch. He helped a viola player with shoulder strain by suggesting a chin rest.
I wrote him a prescription for it. He took it to the violin shop. I'm one of the few doctors that write prescriptions for violin modifications.
It takes special technique to rehabilitate a dancing injury. This equipment allows a person to simulate the movements of dance without the physical stresses. Florine Tubb, age 15, has spent months recuperating from foot surgery.
Since I've been dancing here, I feel more secure with myself and more like, because dance it's kind of like my whole life. So when I stopped dance, I kind of felt really depressed. And then when I come back here, I feel much better.
She believes the treatment probably saved what will hopefully be a career in dance.
It kind of felt like my whole future just kind of went away, because all my life I've been planning on being a dancer, a teacher, a choreographer.
It's easy to appreciate the aesthetics of a performance. It's much more difficult to understand the work and the pain that goes into it. Being an artist is like being an athlete. Getting injured is often a part of the job.
For 10 years, Bob Waters made his living entertaining on the piano. Then came a terrible pain in his right hand.
I went to an arm surgeon, and then I went to a neurologist, and I even tried acupuncture for a while. And none of that seemed to work. And I had to give up piano playing entirely.
Keep an eye on the screen. It's important to reduce the green line, bring that farther down, increase the blue. Go ahead.
Now Waters is hoping that biofeedback will help correct the stress injury that ended his musical career.
A lot of times you don't think that you're tensing in a particular area at all. You think you might be very relaxed. And then all of a sudden you'll have the biofeedback machine hooked up to both arms, and you realize you're not quite as relaxed as you think you are.
Waters says the pain is largely gone. Now he's working on regaining his dexterity.
So far it's been wonderful. Again, I have to take it a day at a time.
The treatment and the prescription can be quite specific.
So, for example, if a musician is having a pain with stretching the hand, we can say to them, play Bach and Mozart, but stay away from Rachmaninoff and stay away from Beethoven.
The rewards in practicing arts medicine are obvious. A talented surgeon saved Mikhail Baryshnikov's career. If medicine is an art, it can indeed be practiced with great beauty.
Jeff Levine, CNN Medical News, Washington.
Dr. Norris says performers are not temperamental patients. Like many athletes, they realize the quickest way back into action is to follow their therapist's cues. Coming up.